Yeah, so I'm going to talk about DVHFI, Domestic Violence Housing First Initiative. My director at the time and I saw a need in the community that there were those that were not willing or didn't need to necessarily enter into shelter, but could not access Eden Rapid Rehousing for housing assistance. So we came up with this programming to kind of fill that need for those in the community that may have a family member or a friend to stay with temporarily, whether fleeing domestic violence and don't necessarily need to enter into shelter. So this program is specific to those that are not entering into shelter and to those in the community. So just move all this stuff out of my way. Okay. So Journey Center for Safety and Healing provides services that foster safety and healing to those affected by child abuse, domestic violence, and prevents abuse through education, advocacy, and systemic change. We envision a community where safety and well-being are achieved by empowering people to find a path toward healthy, thriving relationships. And in this case, with our housing program, a safe, livable environment that the survivor can build basically a new life. And our mission in DVHFI is to help them get to that point. So what DVHFI is we provide 12 months of housing assistance, and we're partnering with an agency, Eden Rapid Rehousing, to provide that 12 months of housing assistance and also security deposit. And the criteria to entering into our program is that it's safe for them to live in Cuyahoga County. This voucher, we don't necessarily like to call it a voucher. Let's call it housing assistance, does not reach outside of the county as far as a unit that person can enter into. They must be fleeing domestic violence within the last 3 months. They're seeking safe, independent housing away from their perpetrator, and they have not received Eden Rapid Rehousing within the last 2 years. So Eden Rapid Rehousing, you might be familiar, is also provided within the shelter systems, but this one is specific to domestic violence. And so this program in particular, they do not have to be in living in shelter to receive it. One of our main challenges was to remove some barriers into entering into any rental assistance. As you know, in Cuyahoga County, it's very difficult sometimes to receive rental assistance. There's barriers such as like income, must have some type of income to receive this. Can't be, must be a legal document in the United States to receive housing assistance, but this isn't the case for this particular programming. We have removed or eliminated any prerequisites to receiving the rental assistance. And again, we used an evidence-based case management model to identify the need. And that's how we built this programming around that. So what is the need? What are the barriers? And let's build something that is going to cater to those that may not be able to access other housing assistance models in the community. So again, it is security deposit in 12 months rent, or let's say we need to service those that are in the CMHA housing, public, Section 8, HCVP, or HUD housing. So that survivor is able to access VAWA funds for relocation. However, to relocate, they still need to pay a security deposit. So those individuals can enter into our programming in order to receive the security deposit only for that subsidized housing unit. However, they won't be able to utilize the Eden funds for 1 year since they're already in a subsidized unit. So that would be just security deposit for those that are in CMHA or a HUD unit. And the check is provided from Eden to the landlord directly on a monthly basis. So it's not a month, excuse me, let me drink. So it's not a lump sum check. it is paid out monthly to the property manager. Again, eligibility, very important, is that they are fleeing domestic violence in the last 3 months, has not received rapid rehousing within the last 2 years. And this is a Eden requirement, not a Journey Center requirement. And it is safe for them to live in Cuyahoga County. A lot of times we're relocating those from the west side to the east side, or east side to the west side. It just depends. So that we can find safe alternatives for those perpetrators that are inside of Cuyahoga County, just by providing, a move within Cuyahoga. So the workflow for DVHFI referral. So how do I get my survivor to enter into this program? Well, the first thing you're going to do is tell them to call our helpline. Our helpline does all our screenings for the programming. They're going to listen for the last 3 months of DV. An incident must have happened within that 3 months, and that they are actively fleeing, that they are in danger, in immediate danger. So that's what will happen on our helpline. Your client will call, ask for housing assistance, and our helpline will take over with that referral process. So once the screening is completed with our helpline, the helpline will explain to that survivor over the phone that someone will be in touch with you within a week's time or less to identify the need, identify the survivor's need. Now, a lot of times we will receive the intake. So what will happen is the screening is sent over to our intake specialist, and that intake specialist will look at that screening form and kind of identify different needs or referrals that survivor may need. They also may have that conversation with the survivor and identify that, you're actually in HUD housing, so you're protected under VAWA, so maybe rapid rehousing isn't a good fit. But they do offer those referrals, that referral service for those to receive housing assistance, even though it may not be DVHFI in particular. So the intake specialist is doing a danger assessment as well. This assesses lethality, the risk of homicide, and that's how we identify the need for DVHFI as well. The scoring doesn't deter the process of the referral into our program. Let's say they score lower, but their perpetrator owns a gun. So we take things into account, that their answers. We do a thorough screening as far as screening and intake to make sure that we are providing the services to those in need that are in immediate danger. And then once that intake is done with our specialists, so they call the helpline, they do the screening. Screening is sent to the intake specialist, where they do the DA and the intake. Then our intake specialist will assign them out to our community advocate within DVHFI. This community advocate is our rapid rehousing community advocate. And what they're going to do is walk them through the entire process with Eden Rapid Rehousing. They're going to be their go-to for, questions. This is a very, can be complicated and layered process to obtaining housing. So they're there to remove any barriers, to help with, understanding the programming, understanding the next steps in each part to getting into safe housing. So our community advocates have a big role to play in that survivor's journey to housing. So the community advocate will then set that initial appointment. So no housing paperwork is completed at this point. At this point, you're just being screened into, survivors being screened into our programming. That community advocate is going to set that initial appointment for them to come down to Payne due to safety. And oftentimes some of our survivors are still living with their perpetrator. We make sure that the survivor knows that they need to meet with us at our main office. We do offer Lyft rides. We do safety planning around getting to our office. We provide bus tickets in the event that's needed as well. So we do work with the survivor to make sure that it's a safe mode of transportation for them. We talk about, using aliases in their phones in case they need to keep Journey Center private in their lives. all those little safety plan cues. We listen for those and we know them well, so we make sure that that survivor is safe in this whole process. So at that initial appointment, then we do the Eden Rapid Rehousing referral. That referral is their ticket to the voucher or housing assistance. And they're going to, the advocate is going to complete a individual service plan, an ISP, with that survivor. They're going to help them identify their need to entering housing, whether that's huge utility balances, barriers as far as like, I don't have any furniture, I don't know what I'm going to do, I don't have a fridge or stove for this unit that I'd like to move into. All of that is all encompassed in our community advocacy as far as helping the survivor. So now that the referral is turned into Eden, this is kind of like the process that the referral goes through behind the scenes while the survivor is waiting to enter into housing. So that referral is completed at our appointment. Then at Journey Center, we have housing navigators. An navigator is going to be assigned to that client to help them identify a safe unit in their desired area, in the desired Eden price range, just to fast track the process for them. So our navigators are doing a lot of work trying to identify a safe, livable unit, making sure that the units aren't pest infested, or that the landlord is going to enter the client and then walk away from that client and never do a repair again. So all of these things that we take into account that, let's say vouchers had a bad name for in the past, we're trying to prevent a lot of that, barriers to living in safe housing and they're right as tenants in the units. So our navigators have a big job of matching units to the survivor seeking housing. Once that unit is located, so the navigator has sent a unit to a client and it's a good fit and they have applied to the unit and been approved, they're going to complete a request for lease approval, or an RFLA. You'll hear that paperwork a lot in our programming. That form is provided by Eden for the landlord and the survivor to complete together. This is their ticket to the rent determination for fair market value. It's also their ticket to the inspection to ensure that the unit is in livable condition. Once the rent amount is approved by Eden and the inspection is complete, the unit will then pass inspection, and a intent to rent will be sent to the landlord that's the okay for the survivor to go ahead and move into the unit. We provide through community advocacy, again, furniture resources, utility turn-on resources, anything that might be a barrier to them entering safe housing. We're there to help them along the way. And after that survivor is in housing, we don't say see you later, that's it. They then are attached to our second process of DVHFI, or second part of DVHFI, which is our housing case management. So housing case management is provided for that entire year of rental assistance to provide wraparound services, whether that's job seeking, educational resources, benefits, Social Security, applying for Social Security, anything that survivor has identified in their case plan, their individual service plan, housing stabilization plan. We're there to help them and assist them in that process. We do a client-centered approach, which means we allow the survivor to identify their goals and needs with some positive and motivational interviewing to help them get to that point. Yeah. So again, it's like almost a three-part process to DVHFI. The first part is just entering through our helpline, through our intake specialist. The second part is matching with our community advocate to be a part of the rapid rehousing program and identify a unit. And then the last piece is housing case management once they're housed. And this is, again, just to ensure housing stability so that survivor is set up in such a way that they can be successful. In a lot of cases, during our housing case management for that 1 year, in most cases, we are linking them with the CMHA voucher through emergency housing voucher through CMHA, which will then be a more permanent solution to rental assistance or a subsidy. So for this case management journey center, we take on single adult case management. So any single adult coming through Journey Center will be assigned to us for housing case management. Our families will go over to Frontline Services for their housing case management. However, as the manager of DVHFI, I oversee the case management for Cleveland Rape Crisis Center, Frontline Jewish Family Services, as well as Journey Center. The other partners, as I mentioned, Cleveland Rape Crisis and Jewish Family Services are the only other two agencies able to do the rapid rehousing referral for this voucher. And Frontline Services is our second person, our second provider that helps just with housing case management. And again, they take the families on for us. And we're focusing on building self-sufficiency, addressing all areas in life that may impact housing instability. We are grounded in understanding if individuals are struggling to meet their basic needs due to underlying generational or historical trauma, and housing stabilization plans are completed monthly with the household. So those housing stabilization plans are also monitored by Journey Center, and those come through from CRCC, Frontline Services, and Jewish Family Services as well. Just a quick couple of frequently asked questions that I notice a lot of people ask me about this programming. How long does it take for this process? When will someone locate safe housing? It varies survivor to survivor, honestly, but generally, I do track stats as far as how long it takes from referral to entering into safe housing, and right now it's 80 days. So it is the quickest housing program in Cuyahoga County for the community. However, it still has, you still have many layers to go through as far as rent determination, inspection, also finding a unit. So again, that's about 80 days. So we really try to provide that safety planning in the middle of all of this. Sometimes survivors do need to enter into shelter midway. It doesn't exit them out of our programming at all because they've entered into shelter due to safety. Just at entry, they are a community survivor. If the client is living in CMHA or other HUD subsidized housing under HUD, can they apply for Eden Rapid Rehousing Program DVHFI? Yes, if they're only seeking security deposit. However, we don't get a lot of those referrals since it's much quicker to go through, let's say, PRC or other agencies that might help with security deposit. Again, they're going to be waiting that same 80 days, possibly because an inspection still has to take place for them to release the security deposit. So we don't get it often. We do have a couple of survivors right now that have forfeited their CMHA voucher. We leave it up to the survivor to determine if they would like to forfeit. Normally, they do not want to do that because after the year that survivor is paying 100% of the rent, especially for those that are in multiple bedroom units, 3-4 bedroom units. That price can get quite high for a single mom or a single dad to afford. So oftentimes, once they hear they have to forfeit that voucher, they often do not. So we try to work with them through VAWA and other resources in order to receive some type of assistance with their security deposit. Do clients return to their abuser during the process? Yes. Just this year, we've had quite a few elopements, which means they have just left our programming without responding to us. And oftentimes we can't say that that's the case, but oftentimes that might be the case, and we know this, but it won't deter them from entering back into our program. We're here for them. We know that's the nature of domestic violence. We do ask that there is a waiting period before they re-enter into our programming. But that's it. Yeah, it's something that we see often. Because it's a huge and scary step to leave behind. Let's say the abuser was providing income, or they were providing their basic needs, and to suddenly be cut off of all that, we realize that that's scary, and returning is often sometimes even the safest option in that moment. Their perpetrator is going to they're high risk of homicide, and they know this. Survivors know their perpetrator best. If they feel like now is not the time to be fleeing, we respect that and we understand that, and we're here for them. But yeah, absolutely, they do return midway. Megan, you want to take over for this part, or do you want to do questions?
Absolutely. So there are no questions in the chat as of right now. So if anyone has any questions for Jenna, please put those in the chat and we will get them going. And like I said, I will send a follow-up email with all of this information. It will go up on our website and our YouTube. Full transparency, I am out in July, so it will likely be August before this gets put up. And so there is a question, Jenna, in the chat that says, how can I sign up to the program?
So you will actually just call our helpline, and then I could put the helpline number in the chat if you'd like. And that's how you enter into the programming. And again, there's that screening and intake process as well.
And Jenna, what about if someone wanted to be a landlord, for example? How would they go about that?
Yeah, so we have housing navigators to follow up with that property manager. They would just need to reach out to either a helpline, that's fine, and just ask for a housing navigator or the DVHFI programming. They can also email me. I can do that. I could put my email in the chat, or Megan can send that over in the email, and then we can get them linked up with one of our navigators.
And Jenna, I know you talked about this at the beginning, but when you do screen your applicants, can you talk about kind of the 3 bullet points for folks when they call the helpline?
Yeah, so fleeing within the last 90 days. And they have to be able to live in Cuyahoga County safely. We can't service those wanting to live out of county because the voucher doesn't reach out of the county. And they also have to be in immediate danger. So as long as they are actively fleeing within the last 3 months, and that they are safe to live within Cuyahoga County, they're absolutely eligible. And one thing that I've been adding that I almost forgot, they cannot have had rapid rehousing within the last 2 years.
Thank you. That is all the questions we have. I'm going to stop recording.